Hey everyone, welcome back to another episode of the Golden Nuggets podcast. We are still with Leki.
Yeah.
And before you take him away for your whole run of questions, I got one question. Because I heard that you used to volunteer for Workers' Party, right? So what made you decide to volunteer for Workers' Party before finally joining PSP?
Yeah. So if you recall, in 2013, about 10 of us wanted to set up the Equal Opportunity for Singaporean, that NGO, but it wasn't approved. So all of us charted our own separate paths.
Okay.
A couple of us, 3 of us went into politics.
Okay.
Some others became Facebook, so-called voices. Others continued with trying to do whatever they do in terms of charity. So we all went our separate ways.
Okay.
So I was thinking, if my voice, our objective are to be pursued, the best way is for me to join a political platform, because with a political platform, you can voice it in parliament. And the best political platform, right, other than the government, right, other than the PAP, because they are the government, because to suggest alternatives, you need an alternative route, right?
Yes.
Yeah,
So the best option was Workers' Party. So that's when I started joining them, and I was actually helping more of the Paya Lebar ward,
Okay.
because I like Mr. Chin Shaw Mao.
Okay.
Okay.
So I was helping Paya Lebar ward, and we were helping more of the charity work, like we were giving rice, canned food and all that to the rental houses, like every fortnightly. Somehow the Workers' Party has got a lot of donors. So I think that was good. And also I helped in assessing families whether they qualify to be in our sponsorship list,
Okay.
or we can channel them to the NGOs, like for the Chinese we send it to some temple. Malays, we look at the situation. Although at that time there were a lot of complaints about MUIS dispersing a bit late, right? But that I didn't verify that, so I can't say that. But basically we would channel them according to their religion. Yeah, so that's about it. But I didn't step up to go as a politician to be a candidate.
Okay.
Because at that time my job involved very heavy travelling.
Okay.
Yeah, like I said, I was regional MD for Southeast Asia, South Asia. That means from Philippines all the way to Pakistan, and that job required me a lot of travelling.
Okay. But that was in 2013, right?
2013 we tried to set up
The NGO.
Then I wanted to go into politics. I think I went to join Workers' Party either 2013 or 2014.
Okay.
All the way until 2015 election, right?
Yeah.
I think I was the counting agent. I did help to be a counting agent.
Okay.
Right, if I'm not wrong. Then after that election, it was a shock to us because the opposition lost really badly, the Lee Kuan Yew effect.
Yeah.
After that, I just like Low, I focus on my career.
Okay. Are you currently still working in your company?
Different company,
Okay, but you are still working.
still working.
Okay.
Okay, one question. Sorry, before Ami, what's one corporate mindset that you have, right, that you think politicians should adopt?
The entrepreneurship,
Entrepreneurship.
Okay.
the ability, right, to solve things in multiple ways.
Okay. I think this is an interesting topic because just now when we were discussing about this, right? Like one of the most common rebuttal to any policy proposals that we have is always who is going to fund it, right?
Yeah.
And that is coming to my point of view, like from a lazy afterthought, because if you are very resourceful, you won't think about who's going to fund it. You need to create a way or an ecosystem on how you are going to fund it.
Yep.
Yeah. So yeah, I think that is one very good
mindset to adopt.
Yeah.
Okay, then I think you can now take away.
We don't look at the challenges first. We look at the opportunities first.
Okay.
Right? Yeah.
Yeah. Yes. Okay.
Okay, that's really interesting. I think I want to talk a bit more about the manifesto before I talk about the manifestos, right? Do you have any other thing to ask, Hanafi?
Good. Please go ahead. Get away.
Okay, so a bit of my background. I am a healthcare professional, and also I am running my own business. So there were a few things that really caught my eye. Number one is the thing about having one channel to actually how do I put this? One channel to actually for us to contribute in or to pay and this channel will be the main one that will pay our medical bills, right? Because right now there's MediSave, Medicare, eldership, all these things, right? There's so many things, right? And it's very confusing. Like even for me, when I were to look at my hospital bill, I really do not understand who is paying what.
Yep.
On top of that, I still have my insurance premium that is paying part of the entire bill. So one of the things that I saw from the PSP's manifesto is this. What are your thoughts on this, and how do you think this point can actually benefit the masses, and also what do you think are the lapses that you may have if, let's say, you were to implement this?
Okay. So in order to maneuver around the Singapore healthcare funding, right?
Yeah.
It involves mental gymnastics.
Okay.
It's tough, as you've mentioned, right? So there are so many things, but we can actually improve step by step. So in our manifesto, the first step is actually for the government to pay fully, and we can fund it from other sources of income, right?
Yeah.
Because Manwai is an economist, we look at the revenue streams and all that. So for the MediShield Life and the ElderShield Life, I think, right? Medicare, the two life, the ElderCare Life and MediShield Life, which is the insurance portion of our healthcare system,
Yes.
to be fully funded by the government.
Okay.
If it's fully funded, what does it mean? That means you do not have to deal with it anymore,
Yeah.
right?
Yeah.
So it is less of a complex maneuver on trying to understand what comes from what. Where. That's one. Number two, also, these two insurance components, actually, the premiums tend to tend to go higher
Yeah.
when you age.
Yes.
You must remember this. When the premiums go up, but when you age, your income goes down.
Yes.
So there's a big
That's true.
disparity.
Yeah.
This is a time bomb, right? For the elderly, come 20 years down the road, when I'm not working, right? How am I going to pay a higher premium?
Yeah.
Right. So that's why our party proposes that this should be fully funded by the government. And again, this is insurance policy, right? So insurance, medical insurance. So and it can be funded. So why not? Why put the old folks into so much stress on trying to understand whether I can pay for this bill or not? Right?
Yes.
Yeah. I think this is good. But of course, when we implement a thing, this is the first step. We will later on, if this is successful, then we will try to propose what else to simplify, like what you asked, to simplify the way we tackle healthcare. Right? So it's a step-by-step approach. We cannot revamp everything. I don't think that's the right way too, because if you revamp everything, there'll be some segments that will not be happy. Right? But if we say these two premiums will be funded by by the government, then I think it's a good start. Yeah, and then we can get the buy-in of the citizens when we try to implement the next phase of the policies.
Okay.
Yeah.
Is this going to be something similar like in the UK? They have the NHS.
Different. I don't think we want to follow the UK policy. Actually, I attended the talk by Prof. Anand Tambaya. He was looking at the UK, the NHS, right?
Yeah.
The waiting time is it's crazy. We do not want to put our citizens into that sort of dilemma, having to wait months or more just to get that critical help in terms of their health, right?
Yeah.
So it's not. So ours is a progressive approach. So firstly we try to tackle the premiums first
Okay.
to handle the economic side of it,
Yeah.
right? So the healthcare, the system itself continues,
Yes.
right? In the bill they can put whatever, then you try deduct, right?
Yeah.
That's it. But if this gets implemented, rest assured that the PSP will have follow-on policies on how to improve, to simplify the healthcare system.
Yeah. So that being said, like, could you perhaps give us a sneak peek, a sneak peek about what is the next step? Like, if let's say this policy is being, being proposed in Parliament and it's being what do you call it, executed, right? What is the next step? Like, how do we actually, back to the most annoying question? This is based on my opinion. How do we actually fund this to make sure that in the socio-economic level, this is really being well taken care of by the government?
Yeah, there are voices that say ultimately healthcare is the job of the government to provide for its citizens.
Okay.
This is the extreme view, right?
Okay.
So if we go from this state to go to that state,
Yeah.
it's going to be a revolution.
Yes.
Impossible, right? Because you have to look at where the sources of funds will come from.
Yeah.
So what we're saying is, yes, we can look at the ideal state where all healthcare costs will be borne by the government as the end goal without setting a time frame.
Okay.
Because when you want to implement systems, you have to see that the system gets run first. Right?
Yeah.
You cannot set a time. You must let it go into a gestation period, and then after that get into a normalization period, and finally stable state.
Yeah.
Right? Once that gets into the stable state, then we'll move on. But of course, to the idealist, we want healthcare to be free.
Yeah.
I've heard this so many times from my walks, right? So, but is it achievable? Let's be realistic. We are, after all, PSP. We do not want to disrupt everything that the government has put.
Yes.
If you recall, in the first session, I said there are many things in Singapore that we should appreciate.
Yes.
And one of it is actually healthcare, because we have good quality healthcare, good doctors, good nurses, good care.
Yeah.
Right? So, but the issue is more on cost.
Yes.
So let us tackle the cost without affecting the quality of healthcare given to the citizens. First, then we can go step by step towards the ultimate goal. But even this ultimate goal, whether it's achievable or not, I'm not saying anything. But at least you know where is the direction we are heading to. Yeah.
Okay. I think with regards to healthcare, right? Another thing is which I don't see in the manifesto. You can correct me if I'm wrong. Is how do we tackle the manpower issues in the healthcare system? Because me, being a nurse previously, it is really tough. We really see the manpower crunch. And during COVID, when manpower was pretty much stuck because people cannot go in and out, right? A lot of our fellow foreign nurses, after they move back to their country, they decide to either stay there or they decide to go to another country instead of staying in Singapore. So we lose a lot of the foreign nurses as well. How do you think we can actually tackle this issue? Because yes, the socio-economic part is one thing, but even if we settle the socio-economic part of the equation, we still cannot deliver the utmost best care in our healthcare system.
So you're saying, right, the ratio of the healthcare workers
Yes.
to the patients are at such an extraordinary factor.
Yes.
Ratio. Right?
Yes.
They can't cope with it, right?
Yep.
Yeah.
Yeah. So my question is, why don't we look at the type of patients that we have in Singapore? So what kind of patients do we have? We have, first and foremost, priority should be go to the citizens,
Yeah.
right? Then after that, we have the permanent residents. But at the same time, in Singapore, we have many foreign
Yeah.
patients, right?
Yes.
Coming to Singapore, right?
Yeah.
So that's something that we should look at, number one, right? Okay. Number two, you said the foreign nurses left without ever coming back
Yes.
during the COVID period, right?
Correct.
So that was COVID was a disruption.
Yeah.
So my question is, if you know COVID was a disruption, why don't you do a reset of getting back all these healthcare workers, if not from the same origin countries, from alternative origin countries?
Yeah.
Why hasn't it been looked at? If the feedback from the healthcare workers has been given to the authorities, this is something that I appreciate as an input in this podcast, because nobody has ever raised this directly to us.
Yeah.
Right? Truth be told, we are only contesting West Coast, Jurong West GRC, Choa Chu Kang, and the 3 other SMCs, right?
Yep.
So in terms of feedback, we are also limited. Not everyone is a healthcare, right?
Understand.
Professional.
Yes, correct.
So I will take this input and then, inshallah, in future, we can discuss it at policy level for my party. And maybe if you get me elected into parliament,
Yes.
I can raise this. And I will go to you as the expert opinion or feedback channel. Right?
Yes.
Yeah. Thank you.
Most welcome.
Yeah, thank you for taking it as an input, because I think this is something not heard,
Yeah.
and because for me, I have kind of left the industry, so
Kind of.
so I can actually be a bit more vocal about this, whereas I know a lot of my fellow
Peers,
nurses, fellow peers, they do not dare to actually speak up about this.
Yeah, and I think one of the reasons, just to share a bit, like you see in Australia, one nurse is to 6 patients.
Yes.
Whereas in Singapore, one is too many.
Like what's the ratio if you might ask?
On paper, they are saying 1:4, 1:6. That is always on paper.
that's fine,
But truth be told,
On the ground is
on the ground, I do see some of my peers, one shift, one senior nurse, one enrolled nurse, and perhaps one patient care assistant taking care of like 24 patients.
24.
A couple of years back, when I was doing part time in the emergency department at CGH, there was one senior, and then there was one junior, and then there was me, who is a part time staff, right? And the 3 of us were handling that 24 patients inside that kind of like cubicle where previously they held all the potential COVID patients. So 24 patients. It took me at least about 2 to 3 hours to complete the entire
One full round.
one full round of parameters taking and all.
Okay. If I may ask, is the Ministry of Health aware of this situation?
Based on the numbers that is always reported, I don't think they are aware. Yeah, and it's because like I mentioned, like none of my peers will be willing to actually discuss about this because they know that their job is on the line.
On the line, yeah, definitely.
Really? Okay. So, does the quality of care
Is affected? Yes, definitely.
affected?
Yes, definitely.
Oh, this is
There is a lot of issues that can be discussed, but at the same time, certain things, if I were to discuss about it, I may get perhaps lawyer letters because, it's more like when I'm relaying this, it's a bit more like hearsay as compared to like I can give full evidence on these things are really happening. It's just an anecdote for me. Whereas like for you to really get the sensing, you need to be there. You need
on
to
the ground and take the numbers and they
Yes.
can do the
this is
groundwork.
This is revealing. But in terms of the salary, is it reasonable for the healthcare workers?
I know so.
That's one of the reasons why I start my own business.
So it's not. So there's the issue of being overworked at the same time underpaid.
Yes, the
Yes.
reward
Yeah.
and risk ratio
So-
is not there.
So this is another thing that earlier I discussed on another podcast. Like if you want to talk about the salary, right? I mean, no disrespect to McDonald's crew. I was a crew. I really enjoyed my time when I was working at McDonald's. Okay, McDonald's crews are when they're starting out and they are just O-level holders, right? Starting out as a crew, 2,200 starting pay, starting salary, right? Nurses graduate from diploma, and the diploma is not easy, by the way. and our starting salary is about $2,600.
Wow.
So-
This is from Nanyang Poly, yeah?
Yes, correct. So, like O levels and 3 years of diploma, we really take the effort to study at 3 years to be earning just barely $400 difference.
And what about the pay increment year on year?
It's
Of the salary progression,
it's average standard 3% per year.
cover inflation.
Does it really cover inflation?
Yeah, I mean,
That's another discussion as a whole, right? Yeah. Yeah, but of course, like some of them really, because they want to add up the bonuses, they make it seem like the average income is higher. But truth be told, like it's not. Like it's really difficult for especially like someone like me, having 3 kids in Singapore, trying to live a much more comfortable life with a salary. My last drawn was about $3,800.
Why do you think this is the situation? That the wages of the nurses are not fairly...
So this is another thing. Nobody is uplifting the profession as a whole. Like yeah, it's okay. Like for example, when we talk about influencers, right? There is this perception that influencers really earn well, and some really do. But because of this new gig economy, this new era, this new attention economy, right? The entire profession of being an influencer or being a content creator is uplifted, but there is no efforts in uplifting the nursing profession. So when there's no effort in uplifting the nursing profession, how are people going to be much more enticed to be joining the industry? And then secondly, when the pay just doesn't add up, because the salary is one of the indicators to say that this is actually a good job or not, right?
Yeah.
So if the salary doesn't really entice people, then how do we actually grow our healthcare manpower as a whole? Yeah. So these are the reasons why I feel that in Singapore, as nurses, it's not as easy as it sounds like or as it seems.
Okay. So, what about the foreign nurses? Are they paid the same or lower?
I think for foreign nurses with the employment pass, it's a bit different, right?
It's different.
It's lesser?
Some is actually higher because they may have additionals like what do you call it, like accommodation allowances.
So total cost to the hospital to hire a foreign nurse can possibly be higher than hiring a local.
Yeah.
Yeah, possibly.
Well, if these facts are true, right? Assuming, right, then it's a very serious problem.
Yeah, of course. There is a lot of that we can talk about healthcare, but I think we don't want to bore people about this also, right?
Yeah. I think that's one of the thing in PSP's manifesto that really interests me.
Caught his eye.
Yes.
So different people when we talk to, they caught on to different things.
Yes.
Yes.
Right? Because our manifesto is well crafted. We have many domain experts when doing that. Education, we have professors, we have teachers giving the input. So if you see, our manifesto is very comprehensive.
Yes.
I did compare with others. So previously, I think SDP's manifesto is also good, right?
Yeah, well crafted.
Yeah, well crafted. Yeah. So I think PSP is also very good. That's why today during the nomination, we actually invited the other team to debate with us on any policy matter. Yeah, I hope they will accept our challenge.
Take up the offer.
Take up the offer. The invite.
Invite.
I think we can talk about one more thing that perhaps more people can resonate, right? One of the things that's in the manifesto is about bringing down our GST to back to 7%, right?
Yeah.
The question is, does it really move the needle? And now that we are already paying 9%, right? People have pretty much have in mind like, okay,
they're accustomed to it.
Yeah, they're accustomed to it already, right? So, is it really necessary to bring it down? And secondly, so is it necessary to bring it down? Does it really move the needle? And finally, could this extra 2% be actually better used for other things?
Okay, I like this question because if I'm not wrong, a few other parties also propose
Yes.
to reduce from 9 to 7, right?
Yeah.
Yeah.
And including PSP.
Yes.
Yes.
And that's in our manifesto. And I'm not sure that I can differ from my party's policy, but when you reduce, there are two sides to the argument, right? When you reduce from 9 to 7, there's a possibility that you do not see the effect of reducing prices
Yes.
at the tail end of the value chain.
Yep.
Right? There's a possibility.
Yeah.
But there are some arguments saying that because of the immediate reduction in the GST, when you go to a restaurant, when you go grocery shopping, petrol,
Yeah.
right? If the base cost is the same and the GST is now from 9 to 7, there's immediate savings.
Yep.
Yes.
Right. So the question is, which industries where we can see immediate savings and which we will not. So what we may not see reduction in terms of the prices would be hawker food or kopitiam food, which is a big chunk of the shopping basket, right? We may not see.
Yeah.
But that's fine. But we can immediately see the savings in terms of petrol, grocery shopping, all those built items,
Yes.
where the 9 now reduces to 7. If they do not reduce, you can ask the service provider or the retailer, why so?
Okay.
Right? So there'll be savings, definitely.
Uh-huh.
Okay. And in terms, you don't want to ask in terms of the funding, you know,
Yes.
right? Most of the parties have calculated that because of our net investment returns, and Manwai is the NIRC, Manwai is the expert in this, we have actually surplus, right, from the net investment returns, NIRC. So we can use that to fund instead of burdening the citizens first and then declaring a surplus. Why put such social pressure on the people you're supposed to govern and help?
Yeah.
Doesn't make sense. That's why in our policy proposal, we say we reduce it from 9 to 7, may not cover every angle, but majority of it we still save. And this is also the reason why we dare to challenge them to debate with us on our policy proposal.
So there's another thing, like for us as laymen, right? We don't know where exactly you guys managed to get the data to be able to come up with the manifesto.
Yeah.
You know?
Yeah.
Yeah. So
Okay.
just a side question,
Just a simple for a layman, right?
Yeah.
Okay, so if let's say you reduce 9 to 7, 2% reduction in GST,
Yeah.
right? You can already calculate from the revenue from GST. You take 2% of it. That means that revenue of 2% taken out,
Yes.
and then you look from the NIRC whether it can match to fund this. If our NIRC now is more than the than coming from the 2%, obviously it can be funded, right? Right? Yeah. So like what I said, we have economists in our team, and they've calculated it. That's why our manifesto can stand the test of figures. Can stand the test of numbers. No issue.
So talking about this data, and you have economists in your team to actually come up with the entire manifesto, right?
Yeah.
One more thing that caught my eye was proposing about the minimum salary at 1,600. I think this is
Not 1,600,
2250.
2250.
Sorry,
Yeah.
1,600 is another party.
Really, that's low.
Yeah, it's another party. But anyway, 2250. If this is the proposal, how bad it is for those who are really in the lowest tier of income?
How bad meaning?
Like,
What's the question?
like what is the kind of salary that the lowest salaried person are actually earning
Right now.
See?
Yeah.
You're answering your own question, right? That means you know there are fellow Singaporeans. This is an issue that's close to my heart. There are fellow Singaporeans earning below the minimum living wage of 2250, which was studied, researched by NUS, right? For one to survive in Singapore. How can we, as a first world nation, right? First world nation, look at our fellow Singaporeans earning below the minimum living wage.
Yeah.
PSP believes that every Singapore citizen is an asset to the country, and they deserve to live a dignified life. And dignified life is at 2250. That's the minimum we are saying. The base. We are not saying that that's a life of luxury. No.
That's the
How
baseline.
can you see your fellow citizens earning 1,500 struggling, regardless of whatever vouchers they get, and then another person earning 25,000 of 50,000 a minister's paid or whatever, right? MOS maybe 600,000-700,000 a year. So that's about 70 or whatever, right? I don't want to calculate, about 60, let's say.
Yeah.
The disparity is ridiculous.
Yes.
Doesn't make sense whether you're a citizen or whether you are the government. A government with care and compassion cannot justifiably agree to continue with this system. Cannot. That's why we say a minimum living wage. And we say minimum living wage. We do not say minimum salary. No, different. Minimum living wage. That amount. Yeah.
Minimum living wage, 2250.
Yeah.
But this is based on
A research done by NUS, from what I know, right?
and
Maybe
2250 is based on household income or individual income within the household.
If I'm not wrong, that's for the worker, for the salaried worker, right? Yeah. If I'm not wrong, did you check the manifesto? Yeah, I think so. Yeah. It's in one of our 6 points we want to highlight, right? Yeah. But but you are right. Yeah. If 2250, if it's for the single worker, right? What if they have 6 kids?
Yes, that's right.
Right. Yeah. So that's a separate issue. But like what I said earlier, same thing with healthcare. This is our starting point. As with 2 non-constituency MPs, we already have this starting point, minimum living wage 2250. Imagine we have 5 MPs from West Coast, Jurong West, GRC, myself included.
Yes.
You can imagine the kind of input, the kind of debate, the kind of policies we can propose in Parliament. Starting point, minimum living wage 2250.
Yeah.
It's going to be a process. It's going to progress because cost of living keeps on increasing, and the single biggest problem now we face, amongst the single biggest challenge that the Singaporeans now face, is cost of living issue escalating.
Yes.
Right? That's the common theme, whichever neighborhood we go, save for the ultra rich. So I think this $2250 minimum living wage, right, revenue neutral at least, is a good starting point.
Okay. I think one last point that we can touch on, because of course, if you were to read the manifesto, 76 pages about that.
He remembers. I know it took me a long time to read.
So there's really a lot of points to actually cover, but maybe we can just ask one more. Let's talk about housing in Singapore. What
favorite? Yeah.
like what are the points that is being proposed in the manifesto for PSP in terms of housing? Like on the ground, everybody is saying it doesn't make sense for people to actually own $1 million HDBs, right?
Yeah.
This is one of the biggest thing that is being said on the ground.
Yeah.
But what are some of the points in the manifesto that covers the topic of housing in Singapore?
Okay, I will share with you the 2 key points, and then I will share my own perspective, because I have debates with our own, we call it friends of PSP. I mean, they are basically intellectuals. So I have a debate on that also. So firstly, I will share the 2 points that we have. The 2 key points. We have a lot of proposals there. One is affordable housing scheme, where we take out the land costs from new BTOs. So immediately you reduce the cost by taking out the land, because now the way the government prices the HDB is land cost plus construction cost, right?
Correct.
And plus whatever margin, I'm not sure. So we said take out the land cost, so BTO immediately becomes affordable. Number 2 key proposal is the millennial housing scheme, where we say those people above 28 and all that, they want affordable housing by rental.
Yes.
In decent areas near town, because the youth, they are attracted to the CBD and all that.
Yeah.
Yes.
In good locations in town, we set up rental housing scheme until they have reached the stage of being able to afford to buy their own BTOs, or they are married, they need temporary housing before they buy their own.
Yeah.
This will plug the current gap where it's affecting our total fertility rate. Also, right?
That's true.
Because they don't have proper housing. So how are they going to raise kids and all that? So it's all enmeshed together, all related. So these are the two key points: affordable housing scheme and millennial housing scheme. Many things. But what I had the debate with the friends of PSP is that for any system like what I say, healthcare, this is our starting point.
Yes.
Right? Otherwise, if we change too much, the whole system will crumble.
Yes.
Because this system is not our making. Did PSP do start this problem? No. It wasn't the PSP.
Yeah.
Right? We came here to save.
Yes.
Just like people say, like we are Avengers, right? We just try to save. Okay. Yeah. So just like the housing scheme, I'm saying is that any remedy, any policy proposals that any alternative party put up will inevitably affect certain segments of society. Inevitably, right?
Yeah.
So if let's say you have affordable housing scheme, you have a cheaper BTO, those guys who have bought earlier
Cannot exit
question,
comfortably.
right? Hey, how come you buy at 250, I bought at 500?
Yes.
Yeah.
Is that fair? It's not fair. So what I'm saying is, when a system has gone for far too long, right, without any proper remedy, serious remedy to rectify it, is going to be the biggest challenge. And the government, I don't think, can rectify it. That's why they try to improve it step by step, just like COE, right? Keeps on increasing and all that. So it's a problem. It's a system. It's a running system.
Yes.
Right? But again, SPSP, like what we said, with 2 NCMPs in Parliament previously, this is the starting point, starting solution for our housing issue. So you have to look at it from that perspective.
Yeah.
Right? It's not a solution that can solve all our problems. No. We are not the government. If we become the government, let's say 15 years down the road, then you will see a totally different Singapore. One that will be compassionate, one that will take care all strata of the population, all strata of society. It's different. It's a different vision, right?
I see.
Because we are considered center left party. Right?
Okay.
Okay, anything else? I mean,
I think of course we can really talk a lot. Like I mentioned, the manifesto itself, there's too many points to discuss. But I think we pretty much cover some of the bigger things that it's quite relatable to the masses as a whole. Yeah. So I think we can pretty much continue our discussion off cast.
Yeah. So what I'm saying is that when we go door to door, our manifesto resonates with the residents. So what does it show to you? It shows that we have good policy proposals that can alleviate the suffering of the people.
Yes.
Yeah.
Right.
Yeah.
So that's why we say Progress Singapore Party, our campaign manifesto, our campaign slogan is Progress for all, which means leave no one behind. And for a person coming from my underprivileged social background, this is something that really resonates with me. This is the party that I think Singapore voters should put in Parliament. The kind of parliamentarians we want. Yeah.
you kind of like answer a question that I wanted to ask again. Very good. Like, what is your version of a better Singapore? Right? So, but I do have one last question before we end this podcast. I'm so sorry that we kind of like overshot already, but this has been very interesting.
Yes.
I have one last question. What kind of legacy do you want to leave behind, regardless of the election outcome?
Okay. I'm just an ordinary person. I'm a nobody to leave any kind of legacy. If you want to ask somebody who wants to leave, you ask Mas Agos, what kind of legacy does he want to leave after he leaves office as the Minister of Muslim Affairs? I'm a nobody. I'm just someone who's sacrificing my own career for the sake of fellow Singaporeans. Because if I get elected into parliament, I may not be able to hold my current job, which pays me much more than the MP allowance. True?
Yes.
Yeah. So this is a sacrifice because I believe a life well lived is a life of sacrifice.
Wow.
Okay. I think that's a very nice way to end the podcast.
Yes.
And the last part, must clip it already.
Must clip,
Very nice one.
Yeah. Mr. Leki, thank you so much for being here, for sharing with us your whole journey.
Yes.
And part of the manifesto, although not covered all. But I think it has been an interesting one.
Yeah.
So thank you so much for gracing the studio with us and for sharing with the audience your thoughts as well and wisdom.
Yes.
Thank you.
Okay, with that being said, thank you everyone for tuning in. See you guys in the next one. Bye-bye.